carry out these social changes. Exaggerated in the time, your foundation exists for 3 years. I'd like to call Edgard Morato, who is the founder of startup Saútil, and he'll tell us about his entrepreneurial adventures. Good afternoon, everyone. Thank you for the opportunity of being sharing our story of how we're using technology on behalf of people. And I think that part of this story can inspire you who are considering starting your endeavors in the social area. I think that Brazilians have this potential to make things happen, so we should use it. So I'm going to tell you how we use technologies, especially on the internet, to disseminate information on the health throughout the health area. Where we work here is basically every Brazilian is entitled to use the resources of the public health of SUS, those who have and who don't have a health insurance. It's right to every citizen, and we are talking about 190 million citizens, but most of them do not know what are their rights. So let's see here in the audience, what do you know about what SUS offers? Who uses SUS, the public health program? So most of the people do not know what they can give them, what they're entitled to get medication, vaccination, especially the lower income population, because they do have a scant access to information, and when they go to public health stations, they do not gather that information. They do not know people that can explain that out to them. So because of this problem, we decided to supply this information that is to cover 75% of the Brazilian, so we are trying to cover 75% of the population because only 25% is insured, health insured. So what was a solution that we have created towards this end? We wanted to democratize access to health, to give this population tools that they would be informed and gain access to reach these resources to which they are entitled. So how do we do that? We inform, we supply tools to every Brazilian, get to know what their rights are. And I'm trying to exemplify here a series of tools that Saútil proposes. You can go online right now and see it's for everyone. You will see how in a simple way technology can leave this at the tip of the fingers. And this is our motto, by the way, is your health at the click of a finger. So we created this health search engine. People can find vaccination, medication. If you run a parallel and try to look for this information on the health departments of the government, when there is a health department in a city, you'll have to navigate through 7, 8, 9, 10 links until you get to a PDF list in which you will find 8,000 medicines that you will end up lost. You will not know what you're looking for. So the sites of the the health department, they have a language that is geared toward other managers. It's not geared towards the population, and this is exactly what we're trying to do, is trying to make it simple for the population at large. So you go on with your search, you look for your own city. Each city have their own policies on this regard, and for Florianópolis, for instance, it's different from São Paulo, then it's different from the state of Minas Gerais. So let's use an example here for the Saútil. I choose the city of Florianópolis, and I should look for a certain medicine. For example, Sodic dipirona. Second step, I will ask what is the neighborhood where the person is, or the zip code. And the third step, we can show with what health station can deliver this medicine. And also we supply some technical information, what you should do, whether you should have your SUS card and how to get the SUS card. And also, in the same line, we give the population a voice so that they can comment. We have a space for comments at the bottom, and people can let others know whether they were well served. They may criticize. So we are empowering population so that they can better treat their own health. So it's all geolocated. I made a geo search, and I look exactly for the neighborhood where we are. which is called Agronomica, and we'll find a health station very near here where we can get this medicine from. So if you are a resident of Florianopolis, and you can use this search engine to find where is the best location for you to go and get it for free. So apart from this search engine that works the same way for vaccinations, consultations, for equipment, oxygen probes, and so on, we have created other tools to support people so that they can not only search for things, but they can be rightly empowered. For instance, this health agenda, which they can register free of charge, and they can have their vaccination data recorded here. You can record this for all your family, and this tool will let you know when is the next time you have to take a vaccination. So if I ask, most of you won't remember when was the last time that you had a vaccination. So we tend to forget this information. So we also have tools where you can put a medicine that you're taking, so that you can have a history of all your medication, hints on for your health. You can choose from topics to receive periodically information, and also to other online tools. We also have health areas in which we offer content for the population, so that they can better understand certain issues. For instance, we have risk factors, prevention. We cover several areas, and each of these areas are divided into groups. For instance, within the health, we have respiratory health, and within respiratory health, we have it branches out into other information to help the population. So we'll have information on sleep apnea. These are very simple texts, easy reading, and we have information on where there is a treatment for a respiratory disease in the public network. We explain what the government supplies. We have important institution, what lies outside the public network, where you could get treatment, what NGOs could help you out, what universities offer free of charge services. So you'll have all of this information here. What are the rights of the patient? For instance, a patient that has a respiratory disease that does a treatment with oxygen therapy, he can enroll in the energy utilities, Eletropaulo or Celesc, whatever utilities in your state, so they are prevented whenever there is a blackout in his region. He will have a preference not to have a blackout, so he may have a generator supplied by the utility. So these are rights that the citizens are entitled to, but very few know of them. So it's a space, an independent space, where people can also express their anguish, their fears, and share that with other people, trying to offer or look for support. We also supply videos to give more training. We open up a space for people to talk to specialists, experts in each area, so they can solve their doubts. And a discussion forum, so that people can talk to each other on a given particular disease. We want to create a community so that not only that our side talks to our population, but we want the population to interact with each other. So we want to empower them actually to carry out their own. We let them know where discounts are available for medicines. And all this information is shared on social media, Facebook, Twitter. And we are also expanding. This is the plan for 12-13. It's a startup. We are only 18 months old. The platform has started on internet, and we know that from 140 million people, 180 million people use internet. All the others are using mobile devices, or you're sending it mobile as well. And we also offer different access possibilities. We have those totems, to offer them in places where people circulate the most, like bus stations and so on. And why we do this? It's because we believe that Brazilians, regardless of their social status, they'd like to have use technologies. And we can tell that by the number of mobile phones available in Brazil. There are more cell phones in Brazil than people. And based on that, we know that if we create a strong tool, a content tool to help people, the Brazilians will consume, will use, regardless of their age, regardless of the demographics. And we are actually surprised that 30% of the enrolled people, they are over 40 years of age. So we used to think that only young people would try to look for things like this, but there's a lot of older people now that are looking for to use the technologies to get more information. So without much effort in publicizing our site, this is some of the statistics on our Saútil. Because in the first 6 months we started with this tool only in São Paulo, and then we started spreading to the rest of the country. And the purpose is to make people gain more access to health services and better care for their health. Here I'm going to give you a practical example that it was published in the Pequenas Empresas, Grandes Negócios, small companies, big businesses, covered this story. And this patient was prescribed with eye drop for glaucoma, and it cost 1,000 reais. And his wife started looking on the internet what possibilities there were to find discounts where, and she found Saútil, and we told them that if you go back to your doctor and ask for a generic name of this medicine, he will re-prescribe this medicine, and you can get it for free in the public health system. And she did that. She went back to the doctor. She asked for a new prescription. She went back to the public health station, and she was able to get this glaucoma treatment eye drop for free. And she hadn't done that, possibly he wouldn't have bought and would have his problem aggravated. So this is the possibility that we have for to benefit the people of life. We want to reach 3 million lives to be impacted by 2016. So this is a little bit of the story that I had to tell you, to see if we can inspire some of you to use technologies to help people around, and the problems abound. Thank you very much. Thank you, Edgard. Very nice initiative. I did not know